McCuistion, for over 28 years talking about things that matter with people who care. Production of McCuistion is made possible in part by individual viewers, supporters of the Foundation for Responsible Television, the University of Texas at Dallas, creating the future.
Well, welcome to the McCuistion program, and on this program I'm delighted to say that I have my favorite co-host, Jim Falk. Jim, welcome back, and obviously I think most people now are getting to know that you are the CEO and President of the World Affairs Council of Dallas-Fort Worth, and you're going to sort of lead us through this program on vaccinations.
And I'm glad to be with you. I'm glad to be with you, and this is certainly an important topic. Among the many decisions facing parents is one that concerns public health. In 2019, the United States has experienced a record number of measles cases as a result of some children not being vaccinated. Globally, the trend is equally worrisome, with measles in Europe at a 20-year high. What's riskier, being vaccinated or not being vaccinated? In today's program, we will discuss this debate with two very qualified people. Thank you for being with us. I want to first welcome Dr. Philip Huang. He's the director of the Dallas County Health and Human Services, a position he assumed in January of 2019. He received his MD from UT Southwestern and earned at Harvard University a master's in public health. Joining him is Dr. Elizabeth Thomas. She's a board-certified pediatrician here in Dallas with Diamond Physicians. By the way, we did attempt to reach out to several organizations that advocate against vaccinations, but all declined the opportunity to appear either in the studio or by video. So let's begin, Dr. Thomas, with you. How do vaccines work?
Sure, that's a great question. I'm a mother, and I remember when my kids were very young, crawling towards an object that they shouldn't be putting in their mouth. And my natural instinct was to go and grab the object that was close to them. As we know, kids are exposed to germs or antigens every day on a daily basis. And it's not just in the objects that they put in their mouth, it's from the air we breathe and in the food that we eat. And so what vaccines do is they help to protect our kids from these vaccines. And fortunately, the beauty of the immune system is that it can protect the body by producing antibodies. But there are certain diseases where if it's not protected, if the body is not protected completely, can cause great harm, great disability, or death. And so vaccines work by using the body's natural defenses. They take a small amount of the antigen from the bacteria or the viral antigen, and they put that into the vial, and that's put in a culture medium, and they also add other ingredients. By using this antigen, we are boosting the immune system to be able to recall the disease process or the disease itself and to be able to fight against it. So vaccines are made to protect our kids and our adults as well. And without vaccines, we would see an epidemic of many of these diseases that have been ruled out in the last couple of years. And so there's such great effectiveness to vaccines. This is probably one of the biggest things that I do as a pediatrician to save lives.
Dr. Huang, how do you define an epidemic?
Epidemic is actually a number of cases greater than what's expected. So in some situations, like 3 cases of Ebola might be something that's more extensive than we would expect. But so it's really, it depends on what particular disease or issue we're dealing with.
Well, there are vaccines available for many diseases, but I think we'll focus quite a bit today on measles. And there has been such a remarkable increase in a disease that was virtually eliminated in the United States. Am I not correct?
Correct. I mean, I think in year 2000 it was called that we had no longer have measles in the United States.
I think we have a graph that'll show our viewers a bit more detail about that. Mm-hmm. In the United States, how many cases of measles have there been in 2019?
Well, this year it's been almost about 1,200, I think slightly over that now, and which is the greatest number we've seen since 1992, and again, since we declared it eradicated essentially in 2000.
So that's very interesting that it's the greatest number since 1992. What has caused that increase this year, say, versus 4 or 5 years ago?
You know, there's a lot of misinformation and people not getting vaccinated. And so there are pockets sometimes of groups of people who haven't been vaccinated, and that's where it's concerning, because the overall rates may be higher, but then if you get a certain group that has low vaccination rates, then they can be very susceptible. And so in other parts of the world, there's actually a lot of, there still is measles. And so what's been the situation, people traveling over to those other countries, being susceptible, and then coming back here and spreading it in these groups that are
Are you seeing these increases in specific other countries?
Say that again?
Are you seeing this type of increase?
Well, it's
in
already
other
prevalent.
countries?
I mean, some of these countries have it prevalent sort of as their baseline, so they still...
It never went away to start with.
Right,
saying,
they've still had...
So let me ask you, see if either one of you know this, but when did the measles vaccine come about? What year was that?
1963.
1963.
Right.
Well, let's see. I guess I might have been born by 1963.
I bet you were.
It was close.
I'll be honest, I was in the second grade.
I'm not going to be honest as to where I was. But let's just say when I was a child, vaccination age, so to speak, there was no measles vaccine. And I ended up with the measles, even though it wasn't a bad case. I don't remember our thinking it was all that bad a thing. We had measles and chicken pox are the two things I remember. So what is it about measles that became such a bad thing after all this time?
Well, you might not think about or remember this, but before the vaccine, there were 3 to 4 million cases per year in the United States, about 450 to 500 deaths each year. And so, again, it's a significant problem, and you think 450 to 500 deaths in the United States, that's pretty significant.
Yeah, exactly. But at the time, we didn't know that we didn't have a vaccine, so we didn't know there was anything we could do about it, except, I guess, try to stay to ourselves. Is that right? Because it is fairly contagious, am I right?
Definitely, and there's a 90% risk of transmission to a person that's close by in the vicinity of a person with measles. And I also had chickenpox. I didn't have measles, but I had chickenpox, and I got it before the vaccine was available. And the key thing about certain people that get the disease can have complications, some people don't. Fortunately, I had a mild case, and fortunately, you were okay. But there are some people that get complications from it and can have disability from it or die from it.
And it can also make you susceptible to other diseases.
That's exactly right, and make other people susceptible that are medically exempt from getting vaccines, like babies that are too young, those that are immunocompromised. If they're exposed to you, then they can succumb to the disease as well.
There's a term I came across in getting ready to visit with you, and that was herd immunity. Tell our viewers what that means.
Sure. So herd immunity is a term that basically means community immunity. If you have enough people in the population that are immunized from a certain disease, it helps to protect those people that are medically exempt from receiving those vaccines. So we actually depend on herd immunity to help protect the entire community. So if you have, let's just say we decide we're not going to vaccinate our people, we're just not going to vaccinate, we would see droves and droves of people succumbing to the disease, and we would have an epidemic. So we are relying on the general population to be immunized to protect those that can't be immunized.
Now, some diseases are more contagious than others, so I guess then the percentage to reach for herd immunity must vary.
That's correct. For example, measles, you need to have a certain amount of percentage of people that are immunized to actually protect the general population.
Here are the numbers that I got somewhere. Hopefully they're accurate. That Texas is one of 17 states that allows people to opt out. Is that right?
Correct. Mm-hmm.
Okay, so we allow people to opt out. I think just a few years ago, and maybe in the Dallas area, there were 3,000 who opted out. But I read that last year, 57,000 people opted out. Does that 57,000 perhaps get us in a situation where the herd doesn't work, or am I saying it wrong here?
Yeah, absolutely. As we were saying earlier, I mean, and sometimes frequently they're concentrated, they're clustered in these groups of people who are like-minded that don't want to get vaccines. And so whether it's a particular school, in New York, it was in some Orthodox Jewish communities that were
So it's a religious community there. Is there a religious community here that would have a problem with it in particular, or no?
What's driving it in Texas?
What's driving the
People opt
The
out.
anti-vax.
I mean, I think a lot of it is just misinformation. And several years ago, there was a fraudulent study the author now currently lives in Austin still, but that linked these vaccines to autism.
Autism, right.
But it's been entirely discredited. That individual lost his medical license. But still, in the internet and our social media world, these misinformation continue to
Are you telling me, Philip, that there is misinformation on the internet? Are you really telling me that on this program?
I am.
You are.
But Dennis, where you're hearing this of the
problem,
anti-vax are a lot of celebrities, and it gets that social media and celebrity culture.
Are you telling me that celebrities are not qualified doctors? Are you telling me that?
Well, that's what I've heard.
I am shocked to hear both of these things right here.
It's that Holiday Inn commercial, I think.
Yeah.
But Robert Kennedy Jr. Has been one of the most outspoken advocates of the anti-vax movement, and even some of his relatives wrote an op-ed saying we love him, but what he's saying is not true. Is there any basis for the anti-vax movement?
There really is not. I mean, these are effective, they're safe, they've been, immunizations are considered one of the greatest public health successes of the 20th century, we talked about the measles and not remembering it, but polio, that's something.
Well, let's talk about polio.
Yeah.
My goodness, when did that vaccine come out, you recall?
So that came in 1955.
1955.
There were up to 60,000 cases a year, and you see the pictures of these kids in iron lungs.
Absolutely.
And there were 3,000 deaths. People, there's a quote, one of the things I always use where people talked about, in the summer, they were afraid to have their kids go into the swimming pools and things because it was out there.
Exactly right.
And
of course, I wasn't born in 1955, right. But I remember hearing about that.
And this is the thing, we're really a victim of our own success in that now the, physicians, nurses, and parents don't remember that, don't understand what it used to be.
Let's
like.
talk about not remembering that. I promise you, there is at least one viewer watching this program that doesn't even know what we mean when we say polio. So think about that.
Sure.
So I want to get a plug in for Rotary International. I've been a Rotarian for a long time, and Rotary, as you know, along with the Bill Gates Foundation and their funding and all that, has basically eliminated polio from the face of the earth. Now, there are a few cases here and there, but for the same reasons, people resist doing it. So just to give us a sense, one of you, I don't care which one of you it is, tell that person who doesn't know what polio is, you mentioned iron lung, they sure don't know what that is. What exactly was polio and what's an iron lung, for heaven's sake?
Well, I mean, it's a virus that caused some inflammation around like the nerves, spinal cord, and caused, paralysis. What is it? Which president was it? Roosevelt or?
Yeah, FDR.
The FDR, yeah, that had polio. It was.
And he caught it at a very late age.
Right.
At a very late age. Yeah.
But are there any reasons for children not to be vaccinated? Could they have a lower immunization situation?
Sure. If you have a child that, for example, is on a transplant list, or just received a transplant, they may be immunocompromised, or they were born with a problem with their immune system, they're not able to get live vaccines, for example. So there are situations where we call them medically exempt. They're not able to get the vaccines because if they were given the vaccine, they can get a full-blown disease.
So what happens is you're putting those children at risk if you don't
correct.
vaccinate your children who are medically able to.
Correct.
I've heard some people talk about delayed vaccines. What is the schedule for vaccinations on measles,
Sure.
and is there any
And
justification
smallpox,
to delay it?
Assuming we still use that, do we?
Oh, no, actually smallpox has been eradicated.
Because, so now we don't have to do
Because of
smallpox
vaccines.
because it's been eradicated, right?
So you bring up a good point, Jim, with delayed vaccines, because I get patients in the office that are requesting to delay their vaccines. But the schedule is recommended by the Centers for Disease Control based on studies done at certain ages and the child's risk of getting the disease at that age. So what that means is the vaccines are recommended at certain ages. So if parents wait to give the vaccine, they've actually missed a window of opportunity of protecting their child. It's just like asking them to wear a bicycle helmet or putting a cover over an outlet. We do those things to protect them before they get in trouble. So it's the same way. If you want to take care of the high-risk diseases, go ahead and vaccinate early and don't delay.
Was the medical community sort of behind the 8 ball here, a little lackadaisical? They didn't really realize how strong the anti-vax movement was?
You know, I don't know if it was. I mean, I think it was just, it's hard to fight this misinformation that's out there. You know, I mean, there definitely, you know, physicians have been advocating for this throughout all of this, but you know, with many things, there is misinformation that keeps.
But couldn't the American Medical Association take out billboards as well?
There have been, again, you look at CDC, you know, AMA coming out strongly, but yeah, it's just hard to get over some of this misinformation. And that original study that, you know, came out there, it gets the attention, and it's hard to erase that. You know, again, it lives on in this in the social media.
Speaking of billboards, you have a billboard.
We do have a billboard.
Let's look at the billboard that we do see, and here's one that was seen. That's an anti-vax thing, learntherisk.org.
And that's a compelling title, Learn the Risk.
Yeah.
Right.
I went on the website, looked at it. It looks as if they have a whole bunch of doctors in this thing, but it looks to me as if it's just one person more than anything else. There were 2 doctors who were on there. I watched a little bit of each. So there at least are some doctors who are concerned about this. Now I wonder if part of this is this issue. Today, because we have so much information, and because so much of it is wrong or fake news or whatever, and because people don't trust the government either, the government, CDC, part of the government saying there's no risk, et cetera, and let's just say there may be some concern over people thinking the drug companies are exactly on the up and up because of all the reasons we've seen, not to mention the opioid crisis most recently. So is there just maybe that skepticism of the American Medical Association, the government, drug companies, et cetera?
And as you said, there's so much information. I'm sure, Elizabeth, that mothers and fathers come into your office with reams of paper and saying, look what I found.
That's right. That's right. What I've learned is the most important thing I can do is develop a trusting relationship with the parent. And you do that by listening and acknowledging their concerns, because they have true concerns, they have true fears when they come in, and they're educated. They're coming in with their information. And so when we form a trusting relationship and we can really tell them, this is what the CDC requires, this is what is backed up by many organizations. It's the American Academy of Pediatrics, the American Academy of Family Practitioners. It is backed up, and initially the vaccines are tested and looked at in terms of data and clinical efficacy and side effects. And a committee is looking at all these disease processes and vaccines 3 times a year, and what's interesting is that meeting is actually open to the public. So people can actually come and listen. And once that data is looked at, the CDC makes a recommended schedule, and then that schedule has to be backed up by credible organizations. So for a parent to come and say, this is a conspiracy, it's really endorsed by public health professionals, medical doctors. It's not, we don't get anything out of giving a vaccine. We're doing it for the well-being of the child.
Let me ask you this. If a parent comes in and says, I'm not going to vaccinate my child, will you still treat the patient? Will you take them into your practice?
I will. I will. There are some pediatricians that won't.
So you're not required to treat them?
We're not required to treat them. We can ask them to look for another practice, but my personal thought is I would still take care of the child. My practice works a little bit differently in that we don't have a long wait in the waiting room, and that's the concern of most pediatricians. If you have a parent or a child that's not vaccinated, they can expose other children in the waiting room. In our practice, we don't have them wait very long. So I would bring that child to the back and still take care of them. So.
Is it an economic situation, Dr. Huang? Do you see that people who may not have the means or have adequate insurance, that they're less likely to vaccinate their children?
You know, that's one of the things we do in public health is try to fill those gaps. And so our immunizations are reserved really for persons who are underinsured or uninsured. And so we try to get those as available and accessible as we can. And that's part of what we do in public health.
You know, one thing that I saw just a few days ago, and Elizabeth, you and I talked about it yesterday, was that Facebook now has a new procedure. So if someone goes to Facebook and they ask for information, seek information about vaccines, and they go to an anti-vax site, there'll be a pop-up. And that pop-up will then direct people to the Centers for Diseases and Control, as well as if you're doing it from another country, it'll direct you to the World Health Organization. So that, I think, is a positive development from where you sit.
Right. That's exactly right.
Well, trusting your pediatrician is sort of number one on most people's list, I think. You know, you develop that kind of relationship is great. With the public health, I'm not sure, Philip, how much people really understand the whole concept of public health. I mean, you mentioned vaccines have been a great thing. Just clean water, you know, and water you could actually drink is a big deal from a public health standpoint too. What are the challenges that you're running into, not just in vaccines, but other public health issues that may be related to this?
Well, that's exactly right. I mean, some of the biggest impact we can make on the public health are some of these sort of upstream things. So they're called social determinants of health. You know, just raising the socioeconomic status of a community, the built environment, making sure that there's access to healthy foods and their streets are safe and they can get physical activity as part of their day-to-day day, and wide sidewalks and shaded areas and things like that, as well as early childhood education, workforce development, and opportunities to succeed. And then also, you know, I mean, it's been pointed out some of the sort of historic problems with the criminal justice system that have, sort of kept this cycle of poverty and things going with some of the practices within.
Well, you've worked in Austin, and now you've been in Dallas for, I guess, since the beginning of the year. What are the critical, let's say, 2 or 3 most critical issues in the medical community, public health, here in Texas? You
know, the biggest, well, in Dallas in particular, I think there's huge disparities. And, you know, you look at, it said, you know, the life expectancy between the lowest zip code and those with the highest zip code, it's almost 20-something years difference by just where these people live. And the disparities between South Dallas and other parts of town are tremendous. And
what about child mortality?
Infant mortality, there's definitely disparities. African Americans have some of the highest rates for infant mortality, as well as some of these other diseases and illnesses we're talking about.
Is there a socioeconomic thing on vaccinations? Does that matter, or is it all over the income spectrum? Or do we know lower income people have a tendency to be more, I'm not going to vaccinate? Do we know?
And race as well, because earlier you talked about religion, but do you see anything there with race?
You know, I mean, this is one of the successes in terms of the vaccine preventable diseases. We've got the numbers much lower than some of the other conditions that we see. It's more the chronic disease that you see some of the greatest disparities. I mean, like our measles numbers, we have only had 1 case this year in Dallas, but that was actually a public health success story. I could go into a little more about, but it was because we controlled it that there was only 1 case. So the pertussis is something that we send out a lot of alerts to the different schools, but that's actually throughout the different areas, that some of that because of the waning effectiveness of.
And one of the statistics I saw was that it costs public health and the taxpayers $142,000 for each case of measles because of all the things you have to do to figure out who's involved in it. Is that number right? I mean, it sounds like it's a huge number.
Yeah, I'm not sure exact figure, but that sounds about right. I know.
Well, I got that on the internet, so I'm fairly certain. Okay. I'm fairly certain this is the second time I've turned over water today. I'm fairly certain that must be accurate. Yeah. No, I really did find that in a legitimate thing. And you think about public health standpoint, if somebody gets measles and you don't know where they're connected, and you have to go figure out
That's right.
You know, what their community is all about and how closely they are involved in that.
Well, I know it's estimated that for the last 20 years worth of the immunization protection that we've had, it's saved the country about $1.4 trillion. So.
Well, we have just another minute or two, and I'd like to ask you, Elizabeth, let's do a little role playing.
Okay, sure.
So I'm coming to your office, and I have my grandchild, and I've been reading all these things, and especially, you know, Robert Kennedy Jr. I mean, he's a Kennedy. I got to believe him, right? Don't say anything, Dennis. I don't want to give my grandson this vaccination.
Sure. What I would do is I want to ask you, what is your biggest concern about the vaccine? So Robert Kennedy and his family or his group has said that they don't want you to vaccinate your grandson. But what is your biggest concern about that vaccine?
Because I read that it might get autism. There's a link.
So what I do want to show you is the science that I have and the research that I've done to prove that vaccines do not cause autism. While we don't know all the links of autism, we do know there's multiple studies that vaccines do not cause autism. And I want to show you also the data on what vaccines have done, the success stories. And from my personal experience, I've actually seen a child die from meningitis within 24 hours. So these diseases are real and can cause illness and death. And so I want to go over with you, maybe if we want to come back for another visit, we can discuss it even more. But I always want you to come to our office with any of your concerns. We're happy to talk about it.
I'm sold.
Now this guy is rational. He's going to pay attention to that sort of thing.
Right.
However, there's not everybody like us that are sort of will look at evidence and all that.
Right.
Because some people like Jim would walk in and say that, and in spite of the evidence, they may not believe you.
Right. It's more of having them come back into the office and relay their concerns again and give more information each time, because it can take multiple visits for that relationship to build and for the parent to actually trust me and trust me to say that I'm doing it to help your child, not to harm them.
Dr. Huang, what about the oversight of waivers? I have a doctor who's a good friend. I'm going to ask him for this waiver. Who's going to check to be sure that that's appropriate?
Well, again, there are the personal belief waivers. There are the, for strong religious beliefs also. People can get waivers. There are some hurdles that have to be done in terms of getting the form notarized, having to get them renewed. But
are they tough enough, those hurdles?
Pardon?
Are those hurdles tough enough?
They're not. I mean, as you said, there were some states that have actually eliminated all exemptions except for true medical exemptions, and that is probably the best thing that we could do for public health.
Do you have the funding that you need?
You could always use more. I mean, there's, again, vaccines are such a success. You give the vaccine and it has long-lasting impact. And so, that's something that we still are always looking for resources.
Well, I want to thank you both for joining us. This is a very important topic. And when a decision affects the health and well-being of children, it's not surprising there are strong and diverse opinions. We encourage our viewers in considering the vaccination debate, do your research, fact-check what you read, and consult always with medical professionals. Follow us on Twitter, check McCuistion TV for other important topics, and thank you for joining us as we talk about things that matter with people who care.
For more information, call 214-750-5157 or email nickyn@nickymcquistion.com. Visit our website at www.mcquistiontv.com. You can also follow us on Twitter at www.twitter.com/McQuistionTV or download McQuistion TV video podcast on iTunes.